All right. It's 5:30. I think we're going to go ahead and get started. I want to thank everyone for coming tonight to talk a little bit more about patient and parental mental health and well-being in the setting of pediatric acquired and congenital heart disease. My name is Carol McFarland. I'm one of the pediatric cardiologists here. I'm also the associate director of the high risk program. Um, Couple housekeeping things first. We do ask everyone to keep their cameras and particularly their microphones off unless you're speaking. If you have any questions for the speakers at any time, we do encourage them, but ask you to put them into the chat so that they can address them in the chat throughout the evening, just for time's sake. And the symposium was really organized by our high risk clinic team as well as the parent advisory board. And I want to thank everyone who contributed to organizing this and put in a lot of effort, as well as the support that we have received from Intermountain and the University of Utah to put this together tonight. I think we're all really excited to have a combination of clinicians and parents and patients who are here tonight to talk a little bit more about this important topic. So first, the first few talks of the evening are going to focus a little bit more on parents. And then the second portion of the evening will focus a little bit more on patients. So I'm going to take this off. So our first speaker of the evening tonight is going to be Dr. Laura Bennett Murphy. She's a psychologist whose focus within the Heart Center is helping care for adults with inherited arrhythmias as well as congenital heart disease. And she is going to be speaking about mental health and well-being for parents of children with heart disease. Dr. Bennett Murphy, thank you.
Thank you so much. I'm really excited to be here. So thank you everyone for um, sharing this time with me. I'm really grateful for that. Carol, can you just nod if you can see the slides okay?
Yes, we can see them great.
Okay, perfect. So I have this, like Dr. McFarland said, I'm in a really unique position because I'm half-time working with kids with medical conditions, including those who have cardiac conditions, and I'm half-time working with adults who've grown up with a congenital heart condition. And so I get this really unique and wonderful lens of working with both populations. And often when I'm meeting with our adult patients for the first time, I'll share with them, hey, when you grow up with a heart condition, you're at higher risk in your lifetime for anxiety or depression. Some people struggle with memories of things they've been through. And I'll invite the adults, like, tell me, what's going on with you? What concerns might you have? And one of the most common things that I hear back is, actually, I'm doing okay, but maybe you should talk to my mom. A lot of my adult patients really share with me an awareness that their parents struggled while their child was um, receiving medical care. And so it tickles me and it moves me at the same time. And in fact, we recently had a 20-something-year-old who got the news that he would likely need to have a transplant. And he began to cry. And when I asked him about it, he was like, I know I'll be okay, but I worry about telling my mom. So I share this with you. I mean, it's funny and it's tender, but I share this with you because our kids notice when we're struggling. And our kids, again, we're connected in families. So they're very aware of our ups and downs as well as their own ups and downs. So there was a really nice study done by Nadine Kasparian and the group at Cincinnati Children's Hospital where she interviewed and spoke with parents um, during the fetal period when they were told that their baby had a congenital heart condition. And she published this really lovely study for cardiologists and providers so that we could better understand the parental experience. And these are a couple quotes from the Kasparian paper. The one parent wrote, our lives were flipped upside down and everything was so different. I felt like I fell off of the face of the earth and I had no one anymore. And another parent wrote, the care team didn't focus much on us as parents. However, when I look back, I wish they would. Honestly, our mental health is so important in this journey for our child, but it's often not talked about. And as I was putting this talk together, I think one of the things that I felt the push and pull in my own experience of this is so important. It's important for our parents, it's important for our child patients. And sometimes I feel like when I talk to parents, especially when they're in the middle of a challenging time in their child's medical journey, and I say, it's really important that you take care of yourself. I feel like I often get yeah, yada, 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 back to my kiddo. But in hindsight, when parents maybe are in and their child, when families are in a more solid place, they look back and say, no, I really was struggling. And the child can look back and, as an adult and say the same thing. So let me just tell you a little bit about what the research shows. This a couple studies, one just came out this year, really on what is the mental health of parents of children with congenital heart disease. And it depends on how you measure clinical distress or psychological distress, but the studies kind of vary from 30 to 80% of really struggling with psychological symptoms. And it's unrelated to the severity of the child's heart condition. And again, sometimes parents I work with feel a little sheepish about this. Like, I know that this isn't the worst condition in the world. I know there are kids who have it worse, but I'm struggling. And that's okay. It's not a one-to-one correspondence. That's your baby. And one of my favorite psychologists, her name is Dr. Sylvia Boorstein. She said, when you get pregnant, everyone says, congratulations, but no one tells you you mortgage your heart for the life of your child when you have a baby. Um, yeah, so it's really common for parents to feel a lot of distress when their child has a heart condition. And when that distress is activated, it affects parental mental health, the way you parent and interact with your child, the quality of that relationship with your child, and your own quality of life. And so it's estimated that about 40% of kind of heart parents say they have a need for professional psychological care. And it's because the journey is filled with emotions, hope, sadness, feelings of helplessness and powerlessness, optimism, exhaustion, fear. All those things kind of combine to, I think, at times overwhelm our resources to cope with all the things we're trying to cope with in life. So, one thing I wanted to just make sure I mentioned in our time together today was really to focus on post traumatic symptoms. To see your baby or child go through a heart surgery can be really traumatic. And in fact, rates of trauma may be higher in parents than they are in the pediatric patient themselves. So, about 30 to 50% of parents whose children have critical heart disease have post trauma symptoms. Um, about 25 to 50% report problems with depression or anxiety, and up to 80% report severe psychological distress, especially in that period post surgery for those kids who need surgery. The times you're most vulnerable, what the research would suggest, is the time of diagnosis, so often that fetal period, immediately postpartum, anytime you're in the ICU and your child's in the ICU, the more recent your last procedure. So time can help. The longer you are since the child's last procedure, the tends to be the better the mood. But number of surgeries, ethnicity, your own childhood history. Do you have past struggles with anxiety or depression, or do you have abusive kinds of things or traumatic things? Maybe you saw a forest fire or car accident. When you've had vulnerability in your past, you're a little bit more vulnerable on this journey with your child's medical condition. Also, how satisfied you are with care. And this is something we really try to be very attentive of as providers, and we appreciate your feedback. But the more satisfied parents are with care, the fewer psychological symptoms they have. And then social isolation is a big predictor. And it's hard. I gave a talk for the Heart Center years ago. I said, and often kind of how families resolve they're having a child in the hospital is like, dad goes off and takes care of the kids at home or goes to work and mom is in the hospital, and families are doing this where they're kind of going past each other. And especially with COVID, we couldn't have visitors in the hospital, and that isolation can really be leave us very, very vulnerable. Once high levels of distress are activated, they tend to remain. So this idea that if I just hold on, I'll be okay doesn't really bear out in the literature. If you're really struggling with anxiety or depression or flashbacks and trauma, and it's causing you suffering, it's likely to persist. So we want to help people get support. I don't want to spend a lot of time on this slide except to kind of point out this second point that parents of children with medical complexity report that they most often get support from professionals, from their doctors and healthcare providers, their nurses, their physical therapists, their mental health providers, support groups, that often they feel sort of isolated from family members and others in the community. But what was upsetting to me, and where I think our panel and other people can be really helpful, is a third of parents reported, I don't know where to go to get myself help. I'm here in this primary children's system. I can access help for my child, but I don't know where to go for myself. And so we want to make sure that we let you know who we are and how we can help you with that. Finally, this takes a toll not only on individual well being, but especially marriages. And that's really important for children and for you. So, why does it matter? When parents function better, their children have a better quality of life. They adhere better to treatment, like taking their meds. They have better emotional health, better physical health. Marriages are happier. But it matters because you matter. And I hear this from moms all the time, like, and I hear it from dads all the time. I hear it all the time. It's like, don't worry about me, focus on my child. But you matter. And you keep that family afloat and together. So really quickly, like what can we do? I want you to walk away with some take homes, and most of them you probably know. I'm not going to tell you anything earth shattering, but the keys to resilience are what we call build, broaden, and bend. So build means take those strengths you already have. If it's logic that and getting information, then let's help you get more information. If it's, you know, connecting to other people, let's help you find people to connect to. So build those strengths you already have, broaden your social connections. And life in a hospital and life with a medical condition tend to narrow those, but broadening your connections to others is really a key to resilience. And then bending. For some of us, like more control and are a little bit more routine. And if, as you know, when you live with a medical condition, you can't always control things or predict things. So learning how to be flexible can be tough for some of us, but it's really a key to resilience. So again, I'm sure you've heard this image or heard this analogy before, but if you don't have your own oxygen mask on, you're in no position to help your child. So always put your own oxygen mask on first and then help those around you. Um, you can kind of push through things physically for a few hours and days, but not for weeks and months and years. And so it's really important that you nurture yourself so you have the stamina to support and nurture that child. Again, another image, if the car runs out of gas, nobody's getting anywhere. You are the car and you got to stay fueled. So back to my point that when I talk to people about resilience, often I'll say like, yeah, I get that. Yeah, yeah, yada, yada. I want you to think of it not as like one more thing I have to put on my to-do list. I need to go to the gym. I need to get more sleep. But really think about these acts of self-care are vital and life-giving for me and for my child. So this is something I need, not something I want. We're not talking about an extra, not an I must that is like another drudgery thing I have to do, but this is life-giving for me and my family. So what's the next small step? Like if you realize I'm not moving enough, I'm just sitting at my job or at the hospital, maybe your next small step is just to walk outside and walk to the end of the block and back. And if that's what you can do right now, that's a gift to yourself and a nourishment for yourself that you weren't doing before. So rather than get overwhelmed with a huge list, think, what's my next small step? And then remind yourself why you're doing it, why taking care of you is important for you and your family, why that's consistent with your values. I think the other thing I see in working with adults is they watched their parents put on blinders and push through and not think or reflect about how they were feeling or what they needed, not feeding themselves adequately, not sleeping adequately. Remember, kids learn by seeing what we do, not by what we say, right? And so if they've had a lifetime of watching you not take care of themselves, and we say, but you take care of yourself, I don't take care of myself, but you please do it, it doesn't have the same impact as when your child sees this is important and I live by this and I'm going to help you learn how to nurture your body and nurture your heart and nurture your soul so that you're your best self. So every time you enact it for yourself, you're also teaching it to your child. Um, so the kind of 6 C's of resilience are things like connecting. Ideally, connect with other people, the people that matter, but it's also connection is important with a higher purpose, whether that's being out in nature and feeling like I am part of this big, broad world, or whether it's a greater power or your faith, but feeling connected to something bigger than yourself. In the moment, we can really get lost if we don't have a sense of connection. Encourage you to be compassionate with yourself. Like having a child with medical needs is a parenting journey that is much, much harder. Um, and just be compassionate that some days you're going to falter, and that's okay. Um, knowing when in coping, when to solve a problem, and when you just need to take care of your emotions. I think lots of the time in the medical world, we can't fix it ourselves, and that stinks for a lot of us to feel helpless to change the situation. So work on addressing your emotion. How am I going to sit with my feelings of sadness, frustration, fear? Again, caring for your physical needs, eating, sleeping, those things, controlling what you can, and then leaving some time for contemplation to just really pause and think, where am I and where's my child and what does it all mean right now, today, just in this moment? So, this is a book I really recommend for parents. It's a way to kind of shift your mind frame and know that there are those days when we've all had it. We've had it with our kids, with our spouse, with our doctors. We've had it. Like, how do you nurture your compassion for yourself as you take this journey so that you can be really a great support for your child? And then I'll just end by reminding you that we're here for you. Like, we care about you, we care about your child, and we can't make the journey easier. We can't change the terrain, but we can walk along with you. So please tell us what you need and let us help carry a pack as you make this journey. So that is everything I have. And we stop sharing.
Great. Thank you so much, Dr. Bennett Murphy. I think it's really helpful to highlight, how often this is occurring and why it's so important for our families to think about and to struggle with. Um, I think our next speaker is going to be Amy and Thomas Warmath. They are children, or they are children. They are parents to three children, one of whom happens to have congenital heart disease, and they are going to speak to us a little bit about their experience. Amy and Thomas, go ahead.
Hi, we're Amy and Thomas Warmath. We have three kids, Heidi, who's almost 7, Alex, who's 4, and Pax, who's 10 months old. And Alex is a tetralogy of Fallot patient. He was diagnosed prenatally at 20 weeks. So that meant that we had 20 more weeks to contemplate the reality that he would definitely have to have an open heart repair, that he might have a procedure, might need a procedure immediately at birth. But we also had 20 weeks to get anxious, anticipate, wonder, get a little panicky, and try to start navigating this new reality for us. His birth he went pretty much full term, and his birth went fantastically. We even heard after just a couple days in the NICU at the U, we even heard the words, best TET patient we've ever seen. So we left, we were discharged with him really high on a cloud. 3 weeks later, however, common cold made it into our household, which was no problem for Alex's older sister, but for him, he ended up, us with him, admitted to the Flora primary for a week. And by the end of that week, it became clear that it was no longer the cold that was suppressing his blood oxygen levels, but it was the functionality of his heart. And so, because it was cold and flu season and they weren't quite wanting to do his repair yet, our team recommended a pulmonary valvoplasty to create more space for oxygen to get into his blood. So we went for that. It was supposed to be and should be a very quick, really straightforward procedure that you can go home from not terribly long after. The interventionist did debrief us afterwards, glowingly, and saying how fantastic it all went. We kind of went to gather up our things before seeing him, and then 30 minutes later got a phone call that he had coded and gone into a full pulmonary and cardiac arrest, and that we should come down to the SICU. So it was a day we weren't even planning on being in the SICU, and we hurried in there and walked in to see a room that our son was somewhere in the middle of, but mostly that was full of doctors and nurses who looked terrified, who looked a little panicky still, who were finishing or, completing his resuscitation. And it was terrible. I don't know any other way to put it. It was really awful. And by the time they finally cleared out for us to be able to go in and see him, he didn't look like our son anymore. We went home to see our daughter once they'd re-intubated him, and it felt like, well, we can't do anything here. We've been in here all week, and let's go take a breather and see our daughter. And not long after we made it home, not far from the hospital, a social worker called saying that he had made a turn for the worse. So we drove back to primary, expecting we were going to say goodbye, hoping we would make it in time. But it turned out everything was fine. He came home a week later, not even on oxygen or anything. And we then had the next 5 months to contemplate the reality that life is a lot less predictable and stable than we had assumed. We were waiting for his full repair. And so we kind of had 5 months to come to terms with the reality that we might lose our son. We did have his full repair a few months later, and that went great. And his heart is doing well now.
So through that whole journey and afterwards, I didn't think I needed counseling. My family and I were doing pretty well. Our marriage was fine. I thought all parents of 2 small children just walked around this tired all the time. And none of the typical red flags for depression were there for me. But 6 months after Alex's full repair, a year after he coded, we had his annual checkup with cardiology. And our social worker said that for families whose kids have multiple surgeries, often the second open heart is more difficult emotionally than even the first. And that after a traumatic event, if you wait a long time to get help, it may take more time and more money in counseling to get healthy again. So I knew Alex would have future surgeries, and so I just decided to go for it. Now that I've been through counseling, I can look back on myself in that time and see physiological and emotional differences that I just didn't realize I was living with. Physiological differences, things that were different about how my body worked, not thoughts, not feelings, but differences in my body because of trauma. I was easily startled. My heart rate would spike with just a small amount of stress. I was overreacting to things. I was fatigued. Emotional differences. I was working so hard every day just to keep this low level frustration under control. I would have really vivid memories of our time in the hospital that would be surprising and kind of bothersome. And then this isn't intuitive, but keeping my emotions hidden from my toddler, our daughter was 2 at the time, that was actually worse for her. Babies are born able to read their mother's face, and they hone that skill. And so to tell a 2-year-old that everything is fine and she can read your face like a book that you are not fine is really difficult for her. And honestly, I'm not sure if my kids or I benefited the most from me going to counseling and learning how to talk to them about emotions in a healthy and age-appropriate way. Looking back, I can now see that the worst thing about that time, it wasn't just that I was now afraid of the trauma of almost losing my son. I was afraid of myself, my overreactive body, my exhaustion, how easily I snapped at people if I wasn't just super vigilant all the time. And counseling let me have compassion for the grieving, exhausted, terrified medical mama that I was now. So when I finally got to counseling a year and a half after our traumatic event, I was diagnosed with PTSD, and I was very surprised. I thought I had been doing awesome, but I was also relieved because if the way I was feeling had a name, it had a treatment plan. And so I did cognitive behavioral therapy, EMDR, and grief counseling. I'm not going to go into the first two. If you go to counseling, you and your practitioner will work out the most effective course of action for you. And those were specific to my trauma and my condition. But if you have been touched by a CHD, I really want you to think about grief counseling. With CHD, so many can be treated and corrected, and sometimes from the outside, people can't tell that there's even a heart defect. And so your losses are often invisible, and our caregivers don't always see it. Our family and friends don't see it. You yourself may not realize what you have to grieve, and you might need permission to. I had to accept the reality of the things I had lost. I had lost the experience of a normal pregnancy. I feel like I lost Alex's babyhood. It was just clouded over with grief and stress and trauma. I lived 5 months kind of expecting my son to die because if he didn't live through a cath procedure, open heart surgery was pretty intimidating. The great thing about grief counseling is it gives you a safe time and place to feel the pain, not to numb it or avoid it, but to sit and take the hit. I thought if I faced those feelings and those thoughts that I would come apart, but I did it in a safe place with a professional and I lived through it. So I learned to not be afraid of those emotions. And this isn't my genius. This is my very smart psychiatrist speaking, but I experienced this. Grief is going to come out. And if we don't face it as grief, it is going to come out as anger or anxiety. And I can tell you from personal experience that it will leak out at the most inconvenient times as anxiety or as anger. So obviously with counseling, there's a cost. It takes time and it takes money. There are resources available to you if the cost of it is prohibitive. For us, we had savings set aside for other things, and we just realized, what could we possibly spend our money on now that we wouldn't enjoy more later when we were healthy? And that panned out to be true. And I think our children as adults will look back and say they would gladly forfeit any trip to Disney World to have parents who are emotionally available, emotionally healthy, able to face hard things and coach them through hard things. Something about trauma is it impacts your left brain. This is from the book, The Body Keeps the Score. And I'm going to read a quote from that. And especially if you're a parent of small children, I really want you to think about this. Trauma threatens our ability to imagine, play, plan, learn, and pay attention to other people's needs. I was still doing all of those things as a parent, but it took so much effort for me to do it. And after counseling, those things came much more easily to me. There are for sure other types of treatment. We all know that there are other ways to numb the pain and avoid the pain, but I am still using the tools that I learned in counseling years after going. I'm still using them in new situations and for the people around me too.
And it's a lot easier with hindsight to look back on our experience, as I went to counseling as well. And it's easy to look back on it and see that it makes so much sense. Like, why would I not? But I know from the vantage point of a lot of you all, possibly a lot of husbands as well, it seems really strange, really foreign, like something that's not for me. And so I found myself in a similar but also very different way than Amy, experiencing a year later really, really heavy and really, really intense emotions, moments where I'd be going about my day and I would immediately have my adrenaline spike, my pulse, I could feel it racing. And it was as if I was right back in the SICU. And that moment when we were walked in after Alex coded, I'd be out for a run, and in the middle of it, it would hit me, and I had to do everything I could to not just start sprinting. And I also had a really hard time kind of perceiving, though I cognitively knew the world had gone on while we went through all this. It was also emotionally difficult to understand how everyone else could just have gone on with things. And I wanted to sometimes just grab someone in public and say, don't you know what happened? And that made it, I think, in line with what Dr. Murphy said, very isolating in different ways. So I went through some prolonged exposure therapy and counseling, and it was liberating. It was something that kind of brought me back into the present, which in just about any instance is always a really beneficial and valuable thing. So in hindsight, as strange as it felt, as awkward as it felt, or as intimidating as it felt, I can't even say enough about how worth it was. And I think the analogy that comes to mind for me, I think especially for men, is that if you were doing something and you tore your ACL, there would no one would question that. You go into an orthopedic, you get it treated, maybe you go through surgery in a prolonged period of a lot of physical therapy, and as a result of it, you might even feel kind of tough because it's an indication that you went through something difficult and you were doing something hard enough that it was hard enough that you blew your knee. And in a lot of ways, I think this is really just the same. It makes sense to take care of yourself in that way, even though it's not as easily perceived as a torn up knee. And even though it's not as obvious to everyone else as that, it's what you've gone through with a child with a CHD, whether something that seems minor relative to what else you see in the SICU, or whether it's something that seems major relative to what you see in the SICU. Like we've all been saying so far, taking care of yourself the same way you would take care of your body is a tremendous thing you can do for your family and for your child.
Let me say one more thing off the cuff. Thomas and I have both told each other since going through counseling, we would not wish a congenital heart defect on anyone. We would certainly not wish a traumatic experience on anyone. But now that we have not just been through it, but recovered and found such resiliency and healing through counseling, we wouldn't give up the experience that we've had because it has changed us for the better. It changes how we see the world and other people too.
And if your spouse, one of the greatest things that I in some ways was able to experience from Amy is that if your spouse or partner is doing counseling, give them as much space as they can have for that, or as you can give them. So on my experience, space being time. My experience was that Amy would tell me no need to rush home. So I could stop by, drive a circuitous route, listen to music that would kind of wind me down. And she did an amazing job of giving me space to be in the counseling and then to move through it. And I think we're both a lot healthier for all of it.
Thank you.
I want to say, first of all, thank you both for being willing to relive that experience, for everyone that is listening tonight, and for being willing to share your experiences, particularly with counseling and how beneficial it has been for you guys. I think that's really helpful for other people to hear. So I really appreciate it.
My pleasure.
Yes.
Next up, we have Alexa Black. She is one of our wonderful Heart Center social workers, and she is going to be talking about strategies and resources for coping. Alexa.
Hey, hello everybody. I'm just gonna get this. Let's see. Hold please. Or am I still sharing? Great. Okay. So I'm so excited to be here. Like Dr. McFarland said, I am talking about some strategies for coping and resources for parents with kiddos with congenital heart disease. I'm going to set a timer. I'm going to try and stay as close to 15 to 18 minutes as possible. Okay, so my name is Alexa Black. I am a social worker with the cardiology team. I've been here about a year. My areas of focus are with the fetal and high risk teams. I also wanted to introduce my colleague and partner in crime, Kristen. She's another social worker with the cardiology team, and you will get to see her a little bit later. So I can't forget to mention that we also have Kelly, maybe our transplant social worker, and then Kristen Given, who helps with a lot of our transportation and other resources as well. So I couldn't have a presentation without starting with an Alexa joke, of course. So Alexa, why is parental mental health important? We're going to go over that a lot. I'll kind of piggyback on some of the stuff that Dr. Bennett Murphy talked about, why and how social work gets involved with patients. And then we'll talk about resources by stage, kind of before hospital admission, if your baby gets a diagnosis fetally, during hospital admission, and after post-discharge. So that's our plan. So really anyone can be affected by mental health concerns when they have a kiddo with heart disease. We focus a lot prenatally, especially on moms, but dads, siblings, extended family members, communities, everyone is affected. There are lots of studies to suggest that as many as 10% of dads also go through postpartum depression, and something like 80% of moms go through some sort of changes in postpartum mental health. So this is wide reaching and a little bit more difficult when you've got a kiddo with some medical complexity. Also, we know through lots of studies that when parents have better self-care, then the outcomes for kiddos are better. We also know that heart disease is not an easy road. Some people have it easier than others, but we know that there could be bumps in the road. There could be repeat hospital stays. There's a lot of things that come with parenting and learning how to parent a kid with CHD. So starting in the fetal period, we'll go over just briefly some common challenges. The biggest thing that's been talked a lot about, with people with more experience than I do, before now is grief. The second parents get a positive pregnancy test, they are filling in what their kiddo's life looks like, what the delivery looks like, what the rest of pregnancy looks like. I mean, it's so easy to just think through all these details, and then sometimes parents get slapped with this really hard diagnosis. And there's just immense, immense grief that goes with that. There's also more appointments. We ask you to change your care team and add more people to your team, changes in your routine, whether that's just from appointments in general or, changes in your mental health and what you're doing day to day and how you're coping and processing. And then also a good time to start talking about what makes you feel better. What kind of self care helps you right now, especially when you're in the place of getting a diagnosis and going through stress and then kind of coping with all this new stuff. That really goes forward into the hospital stay and helps people be a little bit more prepared, a little bit more um, ready and knowledgeable about what will help them stay sane during those hard times. And then also, I think it's important to talk about getting support on board as soon as possible, whether that's family members, counseling is huge. We'll talk about that, coping skills, all of that good stuff. Whatever families can do to prepare before the baby is born is very important. And not always, not every family is always able to do that. Um, okay, so the first thing we look at is self care. So therapy is not the be all end all for everybody. I agree with the Warmath that it is immensely helpful for a lot of people. And I think the big thing about going through a fetal diagnosis is that you have to be a little bit flexible in that things can change quickly or change over time, or there's just lots of unknowns and things that could come up. So, thinking about your long term mental health and what you can do in the moment, and this is really, whether you're finding out that your baby has heart disease fetally, or if you're all of a sudden in the hospital setting finding it out that way, or however you find out, just thinking about your long term mental health is really helpful. um, if you are not interested in therapy, there's tons of other things that you can do to support your mental health and to gather more information. There are support groups both locally, nationally. Some people like the national groups because they can kind of fade into the background but take in all the good information that other parents are saying. Others like really local groups because they can be with people who are in the same geographical area and know some of the same things. And then peer interaction, we'll talk about in just a second, but having some peers who know what you're going through and are not family members can also be immensely helpful. What relieves stress for you? If you're a person who likes to paint your nails or watch movies or go for walks, or there's a million jillion things that people do to relieve stress that are really healthy and good ways to cope. Try things and notice those things and then follow them through to hospital stays, to all the hard things you will go to. And then also like how to keep partners involved, how to keep families involved, and boundaries are huge. I can't say enough how, having boundaries with family members who, with the best intentions, really want to be involved, with even your care team. We've got really big teams, and you might be getting a ton of phone calls in a day or being asked to come. It's okay to communicate with your team and say, is this urgent? Do I need to be here right now? Otherwise, we're going to be back at 2 o'clock or whatever that looks like for you. So, I like to push boundaries are hugely important. You also start learning about the heart a lot more, to the point where we probably should give you a medical degree by the time you go through all this stuff. So just like to mention Heartpedia, if you haven't seen it, it's a great app for actually seeing the heart in 3D, and teaching yourself and other family members, friends, that kind of thing about it. Also, this is a good time where you can start applications for social programs, especially if you think you'll qualify. These are like Medicaid, Social Security, those kind of things. If you think there's a chance that your kiddo will qualify, you can start filling out applications and uploading all the documents beforehand. And then once baby is born, plug in their date of birth, their social security number, hit send, and then it's much easier than trying to do it when you've got a baby in the hospital. Also, the family to family program, some of you may be familiar with. We are in the process of revamping it and bringing it back up. This is a family support program. So this is really, right now, we connect families. We try to do it by diagnosis so that you're talking to a family who has had a kiddo with a similar diagnosis, and then you get the ability to talk with them right now by phone or email or, whatever virtual method works for you guys. And soon we'll have our hospital program back up and running where we can have volunteers come in, be with you in the hospital when you choose, otherwise be available just to chat through what their experience was like and things like that. Okay, so hospital admission, I'm going to fly through this a little bit, just because I think the inpatient team takes a lot of this. For families that I meet fetally, I usually follow in the hospital weekly, and we're trying to keep a really good continuum of care, before a baby is born and after through all the stages. So the number one question is, how do I balance time in the hospital with life outside? How do I see other kiddos? How do I take my dog out? How do I um, see other family members, go to my niece's birthday party, go to work? These are really big questions. So I think having some support in and some people with perspective on how that works can help a lot. Um, in general, I see lots of anxiety, lots of worries about how am I going to manage all this stuff. Sometimes we ask you to go home with feeding tubes or oxygen or other medical equipment. And so just, wondering how to do all of that. You guys can do it, and parents do. It's just a lot to think about. So some of the resources available, I if I am following with families, then I'm available. The inpatient social work team is always available in the SICU and on the floor. The Ronald McDonald family rooms are available to everybody, not just families from out of state. So that's a good kind of living room space to go in and get out of the hospital room for a minute, which breaks are incredibly important during this stage. And then there's also other non-clinical spaces like the cafeteria, those kind of things. So you can take a break. Um, Ronald McDonald House is always a great option for families out of state. We're always happy to submit a referral for you and go over all the things with that. Um, if your child is going to be in the hospital around 30 days, we'll start talking about kind of special Medicaid and Social Security options. Um, and then the family to family program, like I said, is growing. Bottom line, just ask. We do notice a lot of things and try to be proactive in what we're recommending for families and what we're offering to families, and that is equitable. But there's a lot out there, and you just have to ask for what you guys need. Okay, post discharge. So, baby or kiddo has been discharged from the hospital. Now you've got to think about real life stuff. The routine has changed from being one of going to the hospital every day and kind of having a visiting schedule and doing, all of these things, to now you're home. So how do you integrate home if this is your first baby? How do you, introduce baby to the home and bring them home with slightly more challenges than somebody whose baby, wasn't in the hospital for the first little bit? How to manage appointments, ongoing concerns for their health and their well-being, and all of that stuff. Um, so I would say this focuses a lot on financial resources, which I think is something that comes into play a lot after discharge. A quick overview of some government resources. If your family qualifies for Medicaid or CHIP, that's a state health insurance program that can be really helpful when you're thinking about long-term finances. Social Security is a federal program, so there's some different requirements and a whole different application. These can feel like applying for full, like it's your full-time job to apply for, but sometimes can be really helpful for families. And your kiddo might qualify for Social Security if they have a number of different heart conditions, especially if the condition is life-limiting. Um, Early intervention services are looking at neurodevelopmental programs for kiddos. The teams will get you connected to those if even when your child is a baby, if it looks like they're going to need some help with their neurodevelopment, which a lot of kids with congenital heart disease do. And then, just some others. We kind of think about it in the hierarchy of um, state and federal programs first, and then is hospital financial assistance available? You can apply, both through University of Utah Healthcare and Intermountain Healthcare. If your kiddo has surgery, also through the pediatric anesthesiology group. And then if those aren't available or for whatever reason, then we can start looking at grants and foundations and different other funding streams to help with the day-to-day things of life. So there's no quick if you get behind or something happens financially, there's not a ton of quick support. So it's good to be proactive about these things. People have all sorts of different ideas about applying for various programs, and I just tell everybody if you are able to take advantage of it, do whatever you can. Because this is the time when you need it, and it's important to take your financial well-being into account as much as other things as well. Um, the medically complex children's waiver, I just wanted to give an update on a few things. That is a Medicaid program for kiddos with more than two specialists involved in their care. That's a state program that is, uh, it's currently has a really long wait list. So we can't add people to the wait list right now, but we'll put lots of information out when that opens up. And then also we are, as a heart center, looking at different ways to screen for parental mental health issues and provide resources. So as you come to clinic, you might be asked to take different surveys or screeners or participate in research. Just be aware that that's coming. And then social determinants of health as well. We're trying to standardize, how we find out, what a social work need is. Are people having barriers to care? Is there lack of access to food or transportation or other resources like that? So just some updates on what's coming. These are just a broad overview of some tips to improve your mental health. These work at any stage of the process. Really, you have to find out what's important to you and what makes you feel better. Take lots of breaks, especially in clinical spaces. Set boundaries. And I really like this idea of focusing on you at least 15 minutes a day. Dr. Bennett Murphy said it best when she said, "You matter." I think that is so true. And honoring yourself and giving yourself, even when you're in a really stressful time, at least 15 minutes a day is hugely important. And then taking things day by day, but remembering the big picture or the goal. So, we're going through all of this stress and stuff so that we can keep your kiddo healthy and happy, and keeping that goal in mind is great, just not as long as you're not compromising yourself in the process. These are just some different apps and books and things that I like. So these will be on the recording. I'll go through that pretty quick. The one I wanted to kind of highlight, well, there's a couple I like. The first two podcasts are really helpful. The first one is done by a mental health professional, a perinatal psychologist, has some great episodes, especially for parents with kids with medical complexity. And then the second one is made actually by a parent who had a kiddo at Primary Children's for a while, and she talks to lots of different professionals, and that might be a good one to look into. Lastly, the My Strength app was just the state of Utah just bought like a contract with them, and so it's free to everyone in the state of Utah. I put the code on there if you wanted to apply for that, but it's got some great tips on mental health, mental well-being, some therapeutic techniques. So if you're a little uncomfortable with going, trying a therapist, you could maybe start there. And then lastly, I'll just include my contact information. We could talk for hours about all of these subjects. But I would say just please reach out. I'm always happy, and Kristen is always happy to chat with you about resources for yourself, for your kiddos. My email and my phone number on there. So thank you so much.
All right. Thank you so much for going through those with us, Alexa. I think the resources are really helpful for families. Um, we are now going to shift our focus a little bit more towards some of our patients that have congenital and acquired heart disease. And our first speaker is going to be Dr. Sean Cunningham. He's the lead psychologist for our Heart Center Neurodevelopmental Clinic, which offers comprehensive developmental assessments at various time points throughout childhood to all of our patients who have heart disease. And he is going to be talking about resiliency in congenital heart disease. Dr. Cunningham. Dr. Cunningham, you're muted.
Yeah, okay. Are you able to see my slides okay?
Yes, it looks
Okay. So I'm excited to move our discussion and get more of the individual perspective on the experiences of individuals with a congenital heart disease. So there have been movements. Let's see, my slides are not forwarding. Let's see. Let me see if I can just take it down to the raw form. And we'll work this way. Okay, let's do a do-over here. Are you still able to see the slides?
yes.
Okay. So we'll do a do-over. But starting over, there have been recent movements within the research performed on outcomes of congenital heart disease to incorporate the important opinions and voices of caregivers and those who have been diagnosed with a congenital heart disease to become involved in academic manuscripts and other work performed by academic researchers. And this is a trend I feel is long overdue. There are very few studies that have incorporated the individual experiences of those with a congenital heart disease and their caregivers. However, one such study, funded by the British Heart Foundation and led by Dr. Rachel Knowles, the researcher at the University College of London, pictured here, asked 400 children ages 10 to 14 who have undergone surgery to send in drawings and firsthand accounts describing what it is like having a congenital heart disease. The individuals that replied gave their perspectives on how congenital heart disease has impacted their quality of life. The sample distribution in the research had a greater amount of children with less severe forms of congenital heart disease. And this distribution is important to note because answers that were representative of a better quality of life tended to reflect individuals that had less severe forms of a congenital heart disease. A theme that kept coming up in the research is the scar left behind by surgery. Children with less severe forms of congenital heart disease were more likely to be proud of their scar, indicating that it showed that they are a survivor or special. Those individuals with severe forms of congenital heart disease did not like other people seeing their scar or asking questions about it. Another finding to the research was that children with less severe forms of a congenital heart disease were more likely to indicate that their heart condition was, quote, not a big thing, as opposed to those with more severe forms of a congenital heart disease. A common theme to all children with congenital heart disease was that they had a feeling of being left out. A common area where children with congenital heart disease had a feeling of being left out was during physical education classes. During these classes, individuals with congenital heart disease were often asked to be the referees or stand at the finish line of different sporting events to determine the winners. There was an expression across children with congenital heart disease that they wanted to be included more in the sport being played as opposed to playing a role on the sideline. A final common theme to the research was that children with congenital heart disease found that friends and teachers who understood and listened to them well and were able to provide support were critical to their overall quality of life growing up. Finally, a search in the area of resiliency of individuals with congenital heart disease found three main areas that were related to each other, each having positive outcomes on overall quality of life. Disease knowledge helped with resiliency, including the knowledge of treatment and prevention of complications. Additionally, greater disease knowledge led to more frequent health promotion behaviors. Another area of resiliency was family functioning. The particular components to family functioning that led to more resiliency in children with congenital heart disease, leading to better outcomes and quality of life, included positive family interactions as opposed to more family dysfunction. Similar to increased disease knowledge, more positive family interactions were also predictive of individuals with congenital heart disease engaging in more positive health promoting behaviors. Finally, engaging in health promoting behaviors was also crucial to resiliency and preventing a poor quality of life among children with congenital heart disease. The best component to health promoting behaviors was the ability to obtain social support, which links back to our friends and teachers slide. Health promoting behaviors also included things like nutrition, life appreciation, and stress management. So thank you. And I'd kind of like to turn things over to our panel now. Before I do, I'd also like to introduce my colleague who assists in the Heart Center follow-up program, Dr. Parker.
Hi, everyone. I'm Dr. Emily Parker. As Dr. Cunningham mentioned, I have the pleasure of working alongside him in our Heart Center neurodevelopmental program, and I'm going to happily help with moderating our panel for our next 30 minutes.
So as we get everybody in the room, we'll kind of start with some introductions. Okay. So let's just start with some easy questions. If anyone wants to volunteer first, just tell us about yourself, name, age, what you're doing these days,
If you would like, I'm happy to go first. My name is Tiffany, Tiffany Passo. I am an adult with congenital heart disease. I was born with a bicuspid aortic valve and critical aortic stenosis, and I've gone through 3 open heart surgeries and 2 ICDs or cardiac defibrillator replacements. So what I'm doing these days, I am a busy working mom of 2 heart-healthy boys and trying to keep up with them. And my husband and I are currently trying to build a house. So.
And Tiffany, thanks so much for sharing. And you actually included the other thing we were curious about, if people wanted to add just one thing they were excited about. So I imagine you're excited for that process to be done, and maybe excited about the process too.
Absolutely. Excited for it to start a little bit more.
Just to start, that'd be good. Wonderful. Is anybody comfortable jumping in next?
Sure.
Answering that same question?
I can go. So my name is John Hochstein. I had a heart transplant 23 and a half years ago, actually at the Primary Children's in Salt Lake City, Utah. When Dr. Shaddy was one of the cardiologists there, Hawkins was a surgeon, and Dr. John Woods, one of the ICU docs. The nurse I still had was still there, the nurse that I proposed to at the end of it, which is comical, Nurse Rose. But I actually am a doctor now at Boston Children's, basically going to walk in the same footsteps. I'm excited about being a doctor and things, and yeah, life is really good right now.
Doug. Anybody else feeling comfortable introducing themselves, saying what they're doing, something exciting going on?
I'll go. My name is Tegan Pettit. I'm 14. I don't know, something I'm excited for, I guess, Halloween. That's cool. I've had 3 open heart surgeries. I almost had a heart transplant a couple times, but it didn't work out. But yeah, so I have hypoplastic left heart syndrome still, but I'm good now, so yeah.
And Tegan, do you have a Halloween costume picked out?
No, not really. I mostly just like Halloween, like hanging out with people, not like costumes, you know.
You've got some time.
Okay. Hi, I'm Lacey Christensen. I am 16 years old. I've had 4 open heart surgeries. My doctors are talking about a transplant in my heart just in a couple of years. But other than that, things I look forward to are horses and horse riding because I get to run and do things on them that I can't normally do. So.
Thanks so much, Jennifer. Did I see that Linda had her hand raised? Did I catch that? If so, Linda, feel free to unmute and go ahead.
Sorry, it was actually a mistake. I was trying to clap for these. I'm so proud of all 4 of these speakers. And I have to tell John that I remember your proposal. That's a long time ago, but I remember you proposing to Rose.
No way. Oh my gosh, what a kill to have a video of that.
Well, Linda, thank you for clapping. So thanks for jumping in. All right, is that all of our panelists? Dr. Cunningham, did we get around to everybody, we think?
Yeah, so one of the things we wanted to do is when you think back about or currently about your experiences with congenital heart disease, what do you feel that you have gained as a strength, a unique strength?
I can talk first. I think I was very lucky with my transplant, especially in the way that I think my family and the community around me saw it. it was always a badge of honor for myself and my family. And I think, you know, my family from a very early age, I remember going to spread, telling the story to spread organ donation awareness. And what that sort of did is it helped instill this sort of sense of gratitude that even on the crummiest of days, I could sort of come back to like, well, I had the transplant so that I could have these ups and downs. Otherwise, I just wouldn't be here. So there's that. But I think within that, there's sort of, I felt like I was invited by my parents in the situation to be just grateful a little bit more easily than I think some of my peers. And I think I ran with that. And someone said earlier this evening about like feeling like you're special. I definitely did, and I still run with that to this day, for better or for worse.
Good to hear. Anybody else have a feeling of a unique strength that they've gained?
Oh, I'm happy to speak as well. I agree with that feeling of, just kind of gratefulness, and sometimes it is kind of a reality check of the stresses throughout day-to-day life. Well, you know what, I wouldn't be experiencing them if the surgeries hadn't worked for me. But I think that one of the biggest strengths it gave me and my parents gave me was teaching me to be an advocate for my own health, teaching me from a young age how to manage what I was going through, what my ACHD was, what medications I was on, and the dosages I should be on, and giving me that um, autonomy to speak up in the healthcare setting. And I've carried that throughout my life to remain knowledgeable, remain an advocate. And it's something I'm trying to encourage my children to do as well, even though they're healthy, just day-to-day stuff, to be an advocate. Yeah.
Certainly some important attributes. Personal advocate, being able to speak up in a healthcare setting, very important. Others care to share any kind of unique strength that they feel they've gained?
Well, I think a unique strength that I've found with my heart stuff is like, because I listen to all my doctors, what they tell me. Like, I've learned so much about the medical field and all these like terminologies and stuff that makes me interested in it. And then maybe like I want to be a cardiologist, I think. So that's kind of something.
Well, John shows you it's possible, huh? Yeah, of course, anything is possible. Was it Lacey?
Yeah. So I learned that I really can't change my heart, but I can change how I like my attitude about it, and how I react to different things, and like if I just whine about it, or if I'm actually just positive about it.
Good. So kind of a mindset change, an early lesson in that. I like that.
Alrighty, thanks everyone for sharing about that. So our next question, speaks to what Dr. Cunningham was saying, that, in the research, finally, we're really trying to work on including individuals with congenital heart disease in the research process, and what questions we ask, and really, having individuals with congenital heart disease be part of that process. And so I think this next question speaks to that a bit. So we're wondering kind of what one challenge, has been about having congenital heart disease that you wish, either friends, teachers, parents, or providers understood better. Has there been something that you feel like it's been difficult for other people to understand that you'd want them to get?
I'm happy to speak up again if if people would like. So I think one of the biggest challenges for me has been just this constant, whether it's in the forefront or in the back of my mind, this constant unknown. You go through your life, you try to make these changes, and you just never know when is my health going to get in the way. You know, as a teenager, I had my most recent open heart surgery when I was 14, and that was a a huge unknown and a huge challenge at that age. But even as an adult now, trying to work full time, I'm constantly, paranoid about making deadlines and making sure I have everything in a row in case something were to come up and then I end up in the hospital, or building, starting the process of building this house. We're thinking about, okay, well, let's not put too many stairs in case we need to, eventually have our health go, or my health goes downhill or something to that effect. You just kind of are always planning around the unknown and waiting for the other shoe to drop. Or if it doesn't, and you kind of get into that routine of life, then it seems like a lot of times health just kind of pops up, and then you're reminded very quickly that it can change on a dime. So go to a doctor's appointment and wind up finding you need another surgery. So just kind of this life.
I think. Oh, go ahead. Go ahead.
Okay, thanks. So one of the challenges I've had is for people to wish I knew that they would see in me is how I really can't do a lot of things like they can. And I know how like it might be just a simple chore, but if you just keep on adding that up, it will cause your heart to hurt. And like I don't know if people understand that. Like it's sometimes difficult for you just to keep doing things, but
Mine's.
Oh, go ahead, Deacon. I think, John, you might have been muted, but maybe we'll throw it to Deacon and then John throw it back to you.
Sorry. Well, I was gonna say mine was a lot like hers because my main thing is like how I was always in the hospital, so then I'm always like behind everybody, like on everything. So like, say with football, like when I don't know, like my friends started playing in like third grade, but I was in the hospital in third grade, so I didn't really start playing till like sixth grade. So then I've always been like way behind, stuff like that. So yeah, I don't know. That's just what I was thinking for mine. But yeah.
Okay, cool. So I think for me, the two things I run into is one's kind of almost comical, but I felt like with a lot of my peers that eventually, as I got a little older, I didn't take myself as seriously as everybody else did because, you know, I was in high school, I wasn't in the hospital, so I was like, woohoo. And so I think I experienced there's a disconnect between me and people sometimes where they like are affected by things more than I am, which seems kind of weird in a sense, but you're kind of like, that bothers you that much? I didn't realize that sometimes I'm said to be bad with secrets because I didn't realize someone cared so much about this thing because it's really not a big deal. I think the other thing is I've gotten into adulthood that I've run into, which is more frustrating, is when searching for like, a life partner and seeing how most of my well, I've had a partner who didn't realize she was going to freak out about my health, but then she did. I was totally healthy, by the way, whole different story. But their families being, yes, I will leave it there. I won't say words because that's an understandable thing. But my dad has two words that he responds to when that happens, and I will not say them because they need to be censored.
Thank you for keeping it family friendly. So let's move on. I like a lot of the themes of kind of like reframing, learning to not take things seriously, kind of learning new perspectives. There's been a lot of talk about stress. And so question we were wondering is, what have you found most stress relieving over the course of your life with congenital heart disease?
I can start off. I think for me and my family and I, if I use grammar correctly, I think for us the biggest sense of purpose and meaning and stress relief is sort of, we found it sort of in our faith, sort of to help understand and make sense of the difficulty that's sort of befallen myself and my family, and what that means for the future. I think that has been a huge source of just reframing things from easily feeling like, why the heck me? Why is this, blah, 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 to seeing a possible meaning behind it. And then I think just personally, I like activities and sports, and recently spike ball has been my go-to and absolute favorite activity. But I'll leave it there.
Anybody else comfortable with sharing what their experience is with the most stress relieving?
So, I'll go. But my anxiety is pretty bad. I've had to take medication with it. So, they've actually upped the dose too. But one of the things I actually go to are like animals. They're literally just the thing I can relate to kind of thing, and they feel how I feel, if that kind of makes sense. But they just kind of help me go through things like stress and stuff like that.
Something that helps me when I'm stressed is, I don't know, I like playing with my baby sister because she's always happy, and then it makes me happy. And then sometimes I like doing something like creative, like making music or making art. And then, yeah, sometimes just watching a show can be relaxing too.
I think I just try and I'm trying to ground myself. I'm usually just trying to breathe in the small moments of, being with my family and um, of being at work with my coworkers. But I honestly I am working on that as well. This is an area that I've struggled with in dealing with my stress, and so um, I I think honestly talking to others and talking to somebody who gets it, like the amazing, social workers and therapists that have been sharing with us tonight, get the chronic life, the living with the chronic illness, and yet still trying to maintain a somewhat normal life. That has helped kind of validate a lot of that and reminded me to come back to the little things and the need to focus on finding activities that do help me reduce my stress, ground me in the moment.
That 15 minutes of self-care comes back. Yeah. So I think we have about 5 minutes left. So maybe we can pick our more important questions from our list.
That sounds good. I think, maybe a good one to go to next, since we're talking a little bit about stress relief and, the stressors that come, for anyone in life, but that there can be more of those stressors, of course, for individuals with congenital heart disease. So thinking a little bit about worries and anxiety. We were curious to ask you all if there was, a time or an experience, something coming up that you were feeling quite anxious about. And if there's anything that you did at that time to help yourself to get through the situation, anything you'd recommend to your former self to try, and perhaps how you felt after the situation that was making you feel more anxious. And this could be something related to a medical procedure that was anxiety provoking, or, a really big social gathering that made you feel nervous, a test at school, med school exams, anything. But curious if there were strategies that were helpful through that process.
Well, sometimes I get anxious about going to the doctors, but then I don't know. I just think about what my mom says when she'll say like, it'll hurt for a little bit, but it'll help for a lot, and then that makes it better because then you just know, like, yeah, it's gonna be hard while it happens, but then afterwards it'll be better than it was before.
I can kind of speak a little more retroactively than presently at the moment. Like you said, an experience happened in the past, what you tell your former self. Uh, like I mentioned, my last open heart surgery was when I was Tegan's age at 14, and it was extremely stressful because previously my last surgery was when I was 2, and so I didn't remember anything, and I'd only heard the stories of my parents saying that I had a very low possibility of surviving that surgery. And so I was, under the impression of very low chance of surviving the current surgery at the time. And yet I didn't feel like I could speak to anybody about it. And so that anxiety kept building. So knowing what I know now, and just the awareness of the need for mental health and mental health understanding is to just speak to people about what you're feeling. If you have a loved one you can confide in, or your healthcare providers, to speak with them, and just find somebody to confide in to help you get through that tough time.
I'll go. So this year I've had a lot of medical things lately, to broken bones, concussions, liver failure, and things like that. But the things that keep me going when I feel stressed or anxious is my siblings. They'll always ship me a text or hug me, and it always makes me feel happy and joyful that like someone cares for me and is out there for me.
I want to basically echo what everyone said. I think at some point there's nothing that I can do to change. For me right now, being on immunosuppressive, my kidneys are questionable how long they'll last. I can't change my current level besides hydrating well, and I can worry about it and freak out all the time, or I can let it go and do what I can right now. So those smaller things, I think it's just learning to live with that uncertainty.
Before we go further with any questioning, I just wanted to check in with Dr. McFarland and make sure that we're keeping with time appropriately.
Yeah, you guys are doing great. You want to do one more question, and then after you guys are done, we're gonna have one of our social workers come up and talk about a mindfulness technique. So if you guys want to go through one more round of questions, and then we can wrap it up.
Yeah, maybe given time, we'll kind of do a short question here. And I'd certainly like to thank all our panelists for being here and sharing this very important information and insightful information. One thing that I think is really good to end on, and that it's been kind of a common theme, is self-care. And I would be very interested to know what have you found to be your most important or successful self-care tip? What benefits you the most? What would you like to share with others as a component of self-care?
I think I would just like to echo what everyone has said of how important it is, and that's something that I honestly was failing at for a very long time and probably will fail again soon. But I'm trying to focus on it. And for me, self care is just giving myself permission to put myself first for 15 minutes maybe if I'm lucky, but at least even 5 minutes. Um, Take a little extra time in the shower to actually, shave your legs or not have to rush out and go do something else. Take a few minutes after, everyone's kind of settled down for the night to do something that I would like to do, like drawing or watching a movie that I want to watch. And just little things, but the main thing is learning to give myself permission to do that. And that's been really hard that I'm working on.
Anybody else have that essential self-care tip?
Yeah, so I don't know, whatever, I don't know, like if I'm stressed or something, then I think what I like to do is like something that's like calming, gets my mind off things, like say get in a pool or read comic books or listen to music or something like that. That's what I like to do.
So my self-care would be taking lots of breaks, like Tiffany said. But I like going outside and enjoying the weather, and even if it's not good, then I'll stay inside and try to like read books or do something that's peaceful and calming to me.
John, you're muted.
All right, there we go. I'll just add that for me, it's taking time for silence and prayer each day.
Well, again, I thank all of you for taking the time to be here and taking a moment to be vulnerable and share. It's very helpful to our community.
I just want to echo what Dr. Cunningham said. We really appreciate all of the panelists being here tonight and being willing to share so much about their lives to everyone else to try and be helpful to someone else that might be in a similar position. We just wanted to end the night with a mindfulness technique. And so Kristen Ontiveros is another one of our Heart Center social workers. She's going to talk us through a mindfulness technique just to end the evening in case this is something that would be useful for anyone to use in the future. So Kristen.
Hi, it's nice to meet you all in person and virtually, since this is our world now. I will make this quick since I know we're at 7 o'clock now. And I am going to play a little bit of background music just to help us all get in the mood. Can anyone hear the music? Okay. Well, we will proceed without the music. I apologize. If everyone can take a second just to get in a comfortable position, and you're welcome to turn your cameras off if they're on. And just take a few deep breaths in through your nose and out through your mouth. You can leave your eyes open, just fix them on a spot that doesn't have any distractions, maybe down on the floor. But I encourage you to close your eyes just to get the full experience. As you sit comfortably, keep breathing in through your mouth or in through your nose and out through your mouth. I want you to visualize yourself sitting in a nature scene and visualize that there is a stream next to you. Maybe there's some trees, some mountains, the wind blowing, anything that brings you peace and comfort. It could be the middle of the summer and maybe you feel the heat of the sun on your skin. Or maybe you enjoy the fall weather a little bit more with the cool breeze. Whatever scene makes you most comfortable. And for the next few minutes, I want you to take each thought that enters your mind and place it on a leaf. Once you've placed that thought on the leaf, I want you to place it stream and watch it float away. As with each thought, continue to place it on the leaf. It could be a good thought, a bad thought, something neutral, something you ate for lunch, whatever the thought is. Place that on a leaf, let it float by. You may notice that thoughts pop in and out. Anytime that happens, just go ahead and place that thought on the leaf. Watch it float down the stream. The stream will go at your own pace, slow or fast. Whatever you envision is perfectly fine. And remember, we're not trying to rush these leaves by, they're just floating away. As you continue to have these thoughts, you might feel a little silly. Maybe you're thinking this is really not a great exercise, and that is totally okay. Even silly thoughts like that, put them on a leaf and let them float by. You may notice that a leaf gets stuck. It just kind of hangs out on the side of the stream. That's okay. Just imagine that it will float away whenever it's ready to go. Or maybe this thought comes up again, something that is stuck in your mind, bothered by this thought. Just continue to place that on the leaf and let it float by over and over. You might also notice that thoughts of pain or memories come up. Again, those thoughts and feelings can go on the leaf and let them pass by. As these thoughts come up, you can say to yourself, I notice myself having a feeling, boredom, impatience, frustration, a painful memory. Your body is feeling a certain way. Maybe your stomach is hurting, but your shoulders are tense. Take a deep breath, let it go. You may also notice that your thoughts come in and out from this exercise, and that's okay. The more that you practice, the more present you'll be. As soon as you realize you've become sidetracked, Just gently bring yourself back to your scene that you created, placing your thoughts on the stream. Whenever you're ready, go to take 3 deep breaths. Your nose, sit for 4 seconds, go through your mouth. Once you're feeling relaxed, you can go ahead and open your eyes. Thank you so much for participating. I hope that was a helpful learning exercise that you can utilize during those 15 minutes that you can take for yourself if that's all you have. This exercise is typically used in acceptance and commitment therapy, but I think overall it's a great technique to utilize. And if you can't remember all of those things that I repeated, there's a PDF that you can easily look up. It's called Leaves on a Stream. And there's also some guided YouTube videos if you enjoyed listening to me. Maybe there's someone on YouTube that you can listen to as well. But I hope that was helpful for everyone. And thank you so much. I look forward to continue to working with you all. All right. Thank you so much, Kristen. I want to thank everyone that presented tonight, that spoke, that shared their stories, and everyone that was here just to participate and talk more about this topic. So with that, it's 7 after 7. Didn't do too bad in going over time, but we'll let everyone go, and thank you so much. Have a good night.